Hello, my name is Syed Hamaad Rahman. I'm currently a third year internal medicine resident at Methodist Dallas Medical Center in Dallas, Texas. It is an honor to discuss our recently published article titled Effects of Glucagon-like Peptide 1 Receptor Agonists on Endoscopy Outcomes, a Systematic Review and Meta-Analysis. This was recently published in the Journal of Gastrointestinal Endoscopy, GIE. This was a study that we conducted to address critical clinical questions in regards to the use of GLP-1 receptor agonists in patients undergoing endoscopic procedures. GLP-1 receptor agonists have revolutionized the management of type 2 diabetes and obesity due to their efficacy in glycemic control and weight reduction. However, the effect on gastric motility, specifically delaying gastric emptying, has raised safety concerns during endoscopic procedures. There were ongoing debates about the risks of retained gastric contents, aspiration, and impaired bowel preparation quality in those patients receiving GLP-1 receptor agonist medications prior to their procedures. Existing guidelines from organizations such as the American Society of Anesthesiologists are based on limited and conflicting sources of evidence. With the increasing number of patients on GLP-1 receptor agonists undergoing procedures like upper endoscopies and colonoscopy, there was a clear need for us to conduct a systematic review and meta-analysis to consolidate the available data. In our meta-analysis, we analyzed 23 studies with a total of 77,271 patients, of whom 4,449 were in the GLP-1 receptor agonist group and 72,703 were in the control group. Out of the 23 studies, 18 studies focused on upper endoscopy outcomes, examining risks like retained gastric contents and aspiration. 7 studies evaluated colonoscopy outcomes with a particular focus on quality of bowel preparation. The key findings from our meta-analysis indicated that among the GLP-1 receptor agonist arm, in those patients undergoing upper endoscopy, 9.8% of them had retained gastric contents, compared to 1.3% in the control group, corresponding to a pooled odds ratio of 15.39%. In regards to aborted procedures, in upper endoscopy, 1.4% of procedures in the GLP-1 receptor agonist group were aborted compared to 0.2% in the controls, with an odds ratio of 13.86. In regards to aspiration events, this was rare in both of the groups, with only 0.07% in the GLP-1 receptor agonist group and 0.003% in the control group having aspiration events. The pooled odds ratio was 21.06, but did not reach statistical significance due to the low event rate. The quality of bowel preparation was also examined in our study. In patients undergoing colonoscopy, 82.2% of patients in the GLP-1 receptor agonist group had satisfactory bowel preparation compared to 82.6% in the control group, with the odds ratio of 0.94 with a p-value of 0.83. This study is the first meta-analysis to address the effects of GLP-1 receptor agonists on both upper endoscopy and colonoscopy outcomes. It provides critical insights into the associated risks and can help guide clinical decisions for managing patients on these medications. Overall, our study did indicate that while GLP-1 receptor agonists receiving patients did have a significantly increased risk of retained gastric contents, this did not translate over to the event rate in regards to aspiration. In regards to bowel preparation in patients undergoing colonoscopy on GLP-1 receptor agonists, our paper indicates that there is not a statistically significant difference in the subjective quality of bowel preparation in patients on the medication or off of the medication. Other areas where further research is needed is in regards to whether or not these patients have retained gastric contents that are solid versus liquid, as many of the papers that we encountered during conducting our meta-analysis did not specify whether the retained gastric contents were mainly solid or liquid. This could have implications on the aspiration risk for these patients. Further research should be conducted in the form of prospective randomized trials to provide more robust data to help clinicians make decisions for these patients. In conclusion, our meta-analysis found that GLP-1 receptor agonists are associated with higher odds of retained gastric content in aborted procedures during upper endoscopy. However, the overall risks of aspiration and poor bowel preparation for colonoscopy remain low. These findings provide valuable information for clinicians to better plan procedures and counsel patients. Our paper has many real life clinical implications for patients who are on GLP-1 receptor agonists and may be undergoing either an upper endoscopy or colonoscopy. Currently, there are many different recommendations in terms of what should happen to these patients before they get their procedures. While some recommend holding their medications for approximately 1 week prior to their procedure, others have recommended perhaps putting the patients on a clear liquid diet given that there does not seem to be any significantly increased risk of aspiration. We hope that with our meta-analysis, we are able to provide more data to help support making these decisions for clinicians dealing with patients on these medications. On behalf of all of the authors of our paper, we would like to thank the Journal of Gastrointestinal Endoscopy, GIE, for allowing us the opportunity to present our work and also to participate in this author interview series. We hope that our paper and our findings will help clinicians make clinical judgments and decisions for patients on GLP-1 receptor agonists who are undergoing upper endoscopy and colonoscopies. And we also hope that our data from our meta-analysis will help support further guidelines in the future and also be the basis of further studies and research in this area.